Hi, it's Dr. Epstein. I have an unusual case today, a scalp reconstruction case on a young woman in her middle-aged woman that suffered trauma 30 years prior, an accident where her hair got caught in a boat prop and she lost portion of her scalp. At that time, so this was over 20 years ago, 25 years ago, she had some like a basic reconstructive procedure where they did a skin graft from her leg. But obviously, as you can see in the area, she's been unable to grow any hair in the area, and she has a relatively large defect that measures 10 centimeters by around 15 centimeters in total greatest dimension. The plan today, because she's got a reasonable enough border of normal hair-bearing scalp, this area is a little thin, but this whole right side is wonderful. What I'm going to be doing today is a tissue expander case, basically the use of a balloon expander. I'm going to be inserting probably 3 balloons. I anticipate 3 balloons, placing one up front, one along here, and then a larger one right up here. These balloon expanders are inserted deflated. I'll be able to show you during the procedure, but they're inserted deflated, and they're inserted under the scalp, a surgical procedure, which takes around an hour and a half. Once they're inserted, these balloon expanders, starting around a week later, I start inflating them. And very similar to what happens in pregnancy, where the skin very slowly stretches out, that's what we're going to be doing with this patient's scalp. Over the span of the next 10 weeks, probably twice a week, she'll get injections that will not hurt her because it'll be through an external port, which you'll be able to see towards later on this video. And in those, into these ports, these external ports which will be sticking out, saline will be injected twice a week starting next week. Over the span of the next, I anticipate 2.5 months, those balloons will stretch out the scalp to where we've generated excess scalp skin. Some patients, this process proceeds very quickly, especially in children, but sometimes in adults as well, it can go very quickly. So if we're going to have 3 large areas of stretched out scalp, here, here, and here. With all that excess scalp, I anticipate being able to remove at least 80% of her scarred scalp. I will also, if I'm unable to remove this area, what we talked about doing is trying some hair grafts in the area, but having all this area covered will allow her to cover over this bald area. And of course, if we put some hair grafts in there, and if she decides to have this pigmented with like a tattoo, that would work. Now, we also have the ability down the road to do perhaps another tissue expansion cycle, but my goal is to get her as much coverage as possible. So the procedure today will be done under oral sedation, and we'll go ahead and get started, and you'll be able to see how this procedure proceeds. Thank you.